So there I was last year as Rona Call showed me the picture of her 2 children she was told she could never have. Rona, I am thrilled that it worked so well for you. And then, of course, there is Bridget, whom you all just met a few moments ago. Bridget found a support network because of our organization. She found her doctor through us, and the 15 drugs she's used to treat her breast cancer have one thing in common. They were supported by Susan G. Komen. You heard her tell the story. And we're going to pray and hope and be right there with you, Bridget, every step in your journey and in your race and your walk. And I compare that to when Susie battled breast cancer 30 years ago. There were only 6 to 8 drugs on the shelf available to her, and none of them worked. Not one. But we've changed that. We haven't changed it enough, but we've changed a lot. Our work supports a broad scope of efforts, from the communities where we help with screening, education, and affordable treatment, to the labs where we support the most cutting-edge research. Each part of this organization plays an important role. And while our responsibilities may be different, our goals are the same: saving and improving lives. One of the best examples of this is the Komen Tissue Bank in Indiana, where I was fortunate enough to visit a few months ago, where we're collecting samples of healthy breast tissue across the spectrum, from early adulthood to menopause, and from across the different races and ethnicities. As we debated this project at the national office, there were a lot of questions. Was this research worth it? Would it help? Should we be spending so much time and money studying healthy breast tissue? But our scientific team convinced us it was a risk worth taking. And to date, Susan G. Komen for the Cure has donated more than $7 million to this project. And thanks to the Tissue Bank, researchers from around the world, from Chicago to Phoenix, from London to Australia, are using their access to these normal specimens to finally understand how breast cancer grows and develops. We're identifying the changes that cells undergo as they transition from normal to malignant, and detecting the earliest indications yet of malignant transformation. Amazing. This research will help us develop new strategies for treatment, detection, and prevention of breast cancer, and it wouldn't be possible without the support of every affiliate and everyone at the national office raising money, giving, every dollar helping. We have affiliates from Indiana to Texas working to support the Tissue Bank financially, promoted and encourage women to become tissue donors. And of course, the research wouldn't be possible without the individual women themselves who've stepped forward to donate their own breast tissue. Women like Tracy Runge and our own Lisa Miller, who became the first women to donate tissue before and then after a diagnosis. At the national, scientific, community, and individual level, Susan G. Komen is working together for the betterment of all women. After a meeting of our scientific team last month, I was approached by Dr. Ben Anderson. Many of you know him, a breast surgeon who's worked with us for many years, and Dr. Anderson told me why he became involved with our organization. He said it's because not only do we fund the best research, but we're also committed to developing the best healthcare delivery systems. And this is especially important for low-resource women and vulnerable populations. We're doing things that no one else is doing. With the economy suffering, the number of uninsured women increasing, we have a lot of work to do in places like Washington, D.C. Screening programs are being cut, letting low-income women fall through the cracks. But we've always believed that where you live and how much money you have shouldn't determine whether you live. That's why over the last 2 years, we've invested more than $7.5 million in D.C. to reduce fragmentation of care and provide access to screening, diagnosis, and treatment specifically geared toward helping African American and low-income women. Our work in creating special education programs for African American women has power. The CDC just published a report highlighting for the first time screening rates for African American women have increased dramatically, And Susan G. Komen was credited for this amazing result. That's what you've done. That's what we've done. Our work is a circle, beginning in communities, extending nationally and into laboratories and hospitals, and then finally back into the community to serve the most vulnerable among us. And in the next 10 years, we must keep this laser-sharp focus on building our successes. There's no rest to be had, because even before the events of the past month, our work was under threat. We still hear cries about the over-pinking of society, despite the fact that thousands of women in inner cities and neighborhoods and rural areas in other countries still don't understand the value of screenings and don't have access to them. Despite the fact that I still get asked, after 35 years, is breast cancer contagious? Is breast cancer contagious? We hear that cancer isn't a serious problem, despite the fact that a woman still dies of breast cancer every 74 seconds, and breast cancer remains the #1 killer of women worldwide. We hear that money is tight and that screening programs have to be cut, despite the fact that these programs save lives and in the long run save money. And so women who need help instead get a spot on some waiting list. We've come so far, and yet we still have so much more road to go. The work ahead may seem daunting, but we must remember how we got here in the first place. I think of Therese Bonney, one of the first women photojournalists to cover World War II. I saw her photographs many years ago, and they didn't capture the battles or the front lines. They captured the stories. She became famous for the pictures she took of the women and children behind the battle lines, in sharing the faces and stories of these people who were also otherwise ignored. Therese brought the war home to America in a way that had never been done before. Her photos gave us a picture of people, a greater appreciation on behalf of all of us of the true cost of war. I can't help but think of the similarities to our organization. 30 years ago, breast cancer, just known as a woman's cancer, the big C. The disease was literally mentioned in whispers. And the brave people who were being impacted by it were hidden from sight, unmentioned, and then just disappeared. It was Susan G. Komen for the cure that brought America to the front lines of this war. We did it by sharing our pictures, our stories, our hopes, our dreams, being vocal about our fight, and helping, yes, our pink warriors who were battling the disease. And that's what we're going to continue to do. That's what we're going to continue to do, my friends. I am so honored to have Susie's name still on this organization. I'm so honored when I see it on the race bibs with the names of our own beloved fighters, each of our own on them. But this has never just been Susie's battle or mine. It's all of ours. It's all of the work all of us need to do. There are lives at stake, including our own. The faces of survivors are all around us in our communities, in this room, and for some of us, in our own mirrors. 30 years ago, when faced with the task of developing a signature fundraising event, we decided on a race for the cure. Why a race? Why a race for the cure? It could have been a walk, a ride. It could have been a run. It's become a race because a race has a finish. Every dollar we raise gets us closer to that finish. Every woman who gains access to treatment gets us closer to that finish. Every new discovery we fund gets us closer to that finish. Every life we save gets us closer to that finish. And I look forward to the day when we cross that finish line together. When our work is done, when our promises stand fulfilled, and when our granddaughters live in an age where it seems unbelievable that women ever died of breast cancer. Standing together, please stand with me. Standing together, we can do it. Let's all say it. We can do it. Thank you.